this chapter, we're going to cover reporting and disclosure requirements. In many states, and there are some federal laws that allow for the disclosure of confidential health information without the patient's consent. In fact, they mandate the reporting of certain information, and we do not have to have the consent of the patient to do that. Now, if the information is disclosed under statutory or regulatory requirements, then that does not subject a healthcare organization or a practitioner to civil liability. What does that mean? That the patient cannot sue an organization or a healthcare provider for reporting information that they're required to report by law, even if the disclosure is made against the patient's wishes. You will find in health information we're not directly responsible for reporting any of that information, except we are usually within the process of reporting births and deaths and fetal deaths, and we are required to do that. And we have a part in the process of getting the birth certificates completed and sent to the state and things like that, and we are responsible in the initiation of the death certificate. But other than that, we're usually not involved in that process. Now, your book will list many examples of things that may have to be reported by law, and the laws can vary from state to state in regard to what has to be reported. In most every state, and I will go on to say all states, require that hospitals or practitioners report cases of actual or suspected child abuse. There will be a definition within the law in every state, and it generally includes both physical and mental harm or threats of harm, sexual abuse, unusual punishment, or unexplained physical injuries. Some states require, or most states require, reporting of abuse of adults or injuries to disabled persons. And what this reporting involves is suspected or known cases of abuse of senior citizens, those individuals that are institutionalized, individuals in a nursing home, or persons suffering from physical or mental impairments. And a practitioner would usually make an initial report over the telephone and then follow up with a written report, and the time frames will be defined by the individual state laws. Some states require controlled drug prescription and abuse reporting. And what this is requiring that physicians and others to identify patients who are obtaining prescriptions for certain controlled drugs and to report their names to the appropriate state and or federal agency. And also some states, but not all, will require physicians to report diagnoses of drug abuse. Some states, only a few, require physicians to report diseases or abnormal health conditions that are caused by the workplace or related to the workplace, any type of injury or disease. And so they're keeping track of trends with certain occupations and certain diseases. Again, not all states require this, but some may require this. Abortion. Some states require hospitals and or practitioners to report abortions along with information about the patient, what the exact procedure was, and any resulting complications. Birth defects or other conditions in children may have to be reported depending on the state. And a list, if a state requires certain reporting that and where the condition can be any one of many things, then the state will also publish a list of the reportable. For example, in this instance, reportable birth defects. And the facilities and the practitioners will have a list of what is required to be reported. Cancer. Many states require hospitals and practitioners to disclose information from the medical records of cancer patients to a central state tumor registry. Alabama does that. We have hospitals that have cancer registries, but we also, if a hospital even doesn't have a cancer registry, a formal cancer registry, all hospitals are required to gather certain information from all of the patients that are diagnosed or have that particular diagnosis of cancer, and then report the information to the main or central tumor registry in the state of Alabama. Death or injury from use of a medical device. This is a federal statute, so it covers everybody. It doesn't vary from state to state, and it requires hospitals to report any death that is the result of the use of a medical device. It has to be reported to the Department of Health and Human Services within 10 days of discovery. Communicable diseases, that's that's probably one of the biggest. All states have reporting laws that require hospitals and practitioners to inform public health officials of cases of infectious diseases, venereal diseases, sexually transmitted diseases. And also in this, there will be a list published by the state of reportable communicable diseases. And so when one of these diseases is encountered, there is a list and say, okay, does this one fall up under? And infectious diseases can be anything, that I'd say is contagious but could be contained, or infectious diseases such as something like Lyme disease or something like that it's caused by, a tick bite or something like that. They keep track of all of these infectious diseases. And so I will post just the example of the list from the state of Alabama of reportable communicable diseases. And as I said, most of the time health information is not involved in that process, but I know one facility that anytime anything was coded and it fell into one of these categories, then it would be kept on a list, and it was just a double check. Usually the lab is the one that is the place that makes the diagnosis of many of the infectious diseases, and so the lab would be the one to report the communicable diseases. But as I said, we had in one particular place where I worked, we just did a double check, and anytime anyone either saw that diagnosis written, for example on the discharge summary or face sheet, or particular codes that were those of the infectious diseases, they would make a list, and like I said, it was just a double check to make sure that all of them were reported. Misadministration of radioactive materials. Again, another federal regulation that requires hospitals or practitioners using radioactive material in the practice of nuclear medicine to obtain a federal license and report any time there is misadministration of any radioactive materials. Of course, and this is part of the vital statistics process. We talked about that, about birth certificates, death certificates, fetal death certificates, those things that we actually are required to report. But all deaths have to be reported at the state level so that the authorities are informed in the event that the deceased was the victim of a crime, but also so that accurate vital statistics can be obtained. So that's something else that I say that I'm giving you examples of things that may have to be reported, but in every state, all deaths have to be reported to the state. Some states require that gunshot and knife wounds be reported because normally, it can be an accident, but normally these would be the result of some sort of criminal activity, and so they may have to be reported. And then just a category with other. And again, these are listed in your textbook. Things that some states will require, others won't. It could be brain injuries, cerebral palsy, women who took DES. If you're not familiar with that, DES is diethylstilbestrol, and it was a drug that women were given. I'm not sure which decade. I want to say back in the 60s, could be 70s, and it was to prevent miscarriage. And then they found out later on that the offspring of these women, that it didn't affect the women, but there's a high rate of cancer in regard to the reproductive organs, both in females and males, of the women who took this DES. So they do studies on this, and so sometimes states will require reporting of any women who took DES. Any environmentally related illnesses, lead poisonings, there's a whole variety, and as I said, if it's required, there will be a listing from the state, except for those on the federal level that must be reported by all states.